I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hi, everybody, and welcome back. Today we have with us some special guests. I'm going to let them introduce themselves, and we're going to dive into some alternative ways to do sustainable medicine. So welcome, everybody. I will start with Suneer. Hi, tell us a bit
Hi.
about you.
Hi, Sarah. Thank you for having us. So my name is Suneer Chander. I'm an emergency medicine physician by training and had been working in the ERs in the Boston area for about 20 years. And then during the pandemic, I wound up getting licensed in multiple states, grew it to 51 states, and dove right deep into telemedicine. I work as a clinician, an advisor, a practice owner for multiple companies. And I've also co-founded a company called the Air Physician Academy, which teaches other doctors how to also dive into telemedicine by becoming a 51er. And we are also a community and peer network where we support each other in our careers.
Perfect. Great. Rachel, hi, welcome.
Hi, thanks for having me too. So, yes, I'm Rachel Quinn. I'm a family medicine doc. I was doing a typical brick and mortar practice for, I think it was 17 years, and then I was in the thick of everything also. And the pandemic, I really loved telemedicine. At some points in my career, even tried to figure out how to do that. I just couldn't figure out how to do that in any sort of a sustainable way. And so just kept grinding. And in I think it was 2019 or so. It was probably 2020, actually. It was during the pandemic. And I was scrolling Facebook and saw your ad for your course and I signed up quickly because of the ability to leave your clinical day with all of your work done. I really enjoyed learning everything that you taught and really was super helpful. Gave me just enough bandwidth to consider other alternatives in my life. And through the coaching and everything that you helped me learn really just to create a different opportunity for myself. And so with Noelle, who was amazing, and just learning about different communities, I heard about a telemedicine course, which I took, and then was able to transition into telemedicine full time doing that initially with just 10 licenses. And then about a year later or so took air, which was new at that time. And so I was in the second cohort and was able to elevate into that 51 licenses, just learned a lot more in depth and additional leadership roles. And so now I'm also full-time telemedicine. I've completely transitioned over, have a variety of clinical roles with different companies as an independent contractor, some leadership roles, MP collaborations, and now diving into coaching. And I'm also one of the coaches for the AIR course, which is probably the most fulfilling part of my day.
That's exciting. And Gina, welcome.
Hi there. So I'm Gina Rosillo. I'm also a family physician. I've been doing primary care for almost 20 years. I only worked for two companies. The most recent one, I worked there for, I believe, almost 14 years. And I've held different leadership roles in that company as well. But always, I think probably on my 10th year, I started to become really anxious. Oh my gosh, if I retire, how do I sustain my income? My daughter's going to medicine. You start panicking. And I've always been in search, at first searching for a side gig. So I ended up with PIMD. And then at Takashi heard about telehealth. And I wasn't seriously thinking about it at first. But then I got to the point in the brick and mortar where I felt I'm not growing anymore. That was actually a late realization for me. I had that realization when I was doing my exit interview with my mentor in brick and mortar. It was my last day. I was doing an exit interview and we were done with our conversation. We were standing and then I told her, you know what? I just realized I think the real reason I'm leaving and transitioning, I feel I'm not growing anymore. So even though I was taking leadership roles, I just felt there was no more room to grow. And I think deep down, each of us, you feel you always want to do more. And now with telemedicine, oh my gosh, yeah. So it's a different kind of busy, but it's the kind of busy where you keep growing because you keep learning. So in brick and mortar, you have all the same different challenges. You're always challenged with different patient concerns, but I feel like it's not making me grow as a doctor, as an individual. And then now, being in telemedicine, I just realized, oh, I'm not even thinking about retirement. Before, that was always my concern. When will I retire? And will I have enough money when I retire? But now being in telemedicine, I just told my friend the other day, oh my gosh, I'm not even thinking about retirement because you feel like this is something you can keep doing. So I started to transition, I believe, 2 years ago, 2024. I first cut down 2.6 of my FTE, but I felt that was harder because there was really no one taking my responsibility when I'm not in clinic. So I'm working zero point 0.6, but my responsibility is still 1.0, right? Just last month, I that was my last day in brick and mortar. So now I'm full-time telemedicine and there's no turning back.
Got it. Okay. Thank you for that. We'll come back to learning a bit more about that. Suneer, let's pop back to you. So you're an emergency physician and then you're transitioning into telemedicine. Tell us what you're doing in telemedicine as an emerge doc.
Okay, so emergency medicine is a very unique specialty in which we actually have a breadth of knowledge and we take care of a lot of urgent care all the way up to really critically ill patients. Obviously, in emergency medicine, we are not taking care of those critically ill patients. We could maybe through working with a hospital system, but even then, you're not managing anyone that is, for lack of a better term right now, circling the drain, right? Instead, in telemedicine, we're working on lower acuity issues. I initially started working in telemedicine doing virtual urgent care. I think that's a very natural stepping stone out of the brick and mortar into telemedicine. But then I started learning new things like sexual health, how to prescribe HIV PrEP to a patient population that just doesn't receive it from their primary care doctors. Oral contraceptives. We all know that women don't have access to oral contraceptives. So it's all stuff I taught myself, learned through doing CME, learning from my colleagues, and really like augmented my knowledge base before I started working telemedicine. There's plenty of opportunity as long as you're willing to learn.
And what was it that drove this pursuit of trying to figure out how to create this as towards others, like teaching others how to do this and setting up your AIR kind of company? What drove that?
Honestly, I think that it came from multiple reasons. One is that we realized that we were practicing telemedicine based on the company's guidance to us. And when we started doing some digging, we realized that we may have not been practicing telemedicine in the most compliant fashion. And our colleagues who were in telemedicine that also didn't know these things. There's complexities, regulations that are state by state that people just don't know. And then we decided to develop this course in order to not only teach ourselves, but teach everyone about how to operate in this space. And I know we come off as a course, but we're more of a peer network where we're trying to figure this out together. It does start off with some education, but Rachel came through and Gina came through the AIR course, but we learn from them every day because of the experience that they have. And they bring that experience back to us and ask us questions and we go get them answered. So I think it's more for, long story short, the reason why we did it is we wanted a community of doctors to collaborate in a space that is actually more complex than doctors actually think it is.
And I expect that to be the case because each of those 51 states is going to have different regulations when it comes to prescribing, different medication laws, different different. How does the insurance work from your point of view as a doctor getting insured to be able to work across all 51 states? Is that something that you had to negotiate? Is that something that was easy? How did that all work?
You're talking about malpractice insurance?
Yeah, your malpractice. Yeah.
Yeah. So I would say it works very similarly to how it works in the brick and mortar setting. You work for a telehealth company, they provide you malpractice insurance, and they do it across state lines. Very similar limits to what you would have in brick and mortar setting. If you work for them, they pay for it most of the time. You can go out and get your own policy, but if you do, that becomes a bit problematic unless you silo the reason why you're getting it out. But that's another thing telemedicine is complicated. What's not complicated is getting malpractice insurance for telemedicine.
Okay, that's worth knowing. So most or all of the doctors that you're seeing, are they actually working under the hub of a telemedicine company, and that's where the patients are coming in from? Or have you got doctors setting up their own telemedicine companies or being individual doctors? How does that work?
Yeah, I think we have a little bit of it all. So we have doctors who come through the program who really just want to learn about the clinical side of telemedicine and how to work it with different companies. Then we have doctors who want to have an individual practice and will set up their own practice, their own shop. And then we have other doctors who are trying to scale a startup telehealth practice from a few states to national presence. So we have all types in our group, which is what I really love about it. It's just, there's no one person that has the same goals, and there's no one person that's resume looked or currently looks like anyone else's resume.
Okay, yeah. In your practice as a telemedicine doctor, do you have any continuity of care with the people that you are looking after and providing health to?
There, there are two different models. Yes, there are models where you're seeing them for a low acuity, one-time visit, problem focused, and then there are also companies that have longitudinal care models in place as well. Both of those opportunities exist.
Yeah. You personally, though, how about your day at the moment? What are you seeing in your clinical practice? What sort of patient panels are you having?
Yeah. So the one that I was that I the one area where I had a longitudinal relationship with patients was with a company that prescribed HIV pre-exposure prophylaxis to patients. Now, that was, I believe it's something like 20 that's a therapy that is 99% effective in a high risk population to prevent HIV, right? 22% of the patients that are eligible to be on that medication are actually on that medication. There's a wide gap of people who should be on it and who are on it. There are a couple of telemedicine companies out there that are trying to solve that gap. I worked for one, saw patients, and took care of them for years while they came back every 3 months, lab work, refills, making sure that they're safe. That was actually, it was one of my favorite jobs to be on.
Love it. And last question for you for a minute, income. Because emergency physician has an income, and people who are working in emergency medicine will know what their kind of income looks like. What does telemedicine look like in comparison?
So I think the way that I would say it is it can vary. And that what I believe is that most doctors who are switching primarily to telemedicine are really looking to replace their current income and have a more flexible time schedule, right? They want more control over their schedule and their geography where they're located. We we believe that number is somewhere between three and $400,000 a year, right? I think that's probably the average salary like a physician makes. With telemedicine, we can coach you guys how to do that in about 25 to 30 hours a week. On top of that, there's more income potential, but it really depends on your value system. Some people really want to work 40, 50, 60 hours a week. Telemedicine has that ability. You can work 24/7 when you want. There's 300 million patients in America, and there's lots of time zones. There's patients to be seen all the time. So you could value golfing, spending time with your kids, working less, We have people who make less than their brick and mortar because they chose to. But the opportunity is there to really have a way higher ceiling than your brick and mortar setting.
Got it. Okay. Thank you so much for that. We'll come back to you, I'm sure.
That
Rachel,
was a non-answer. I feel really uncomfortable talking about money. I'm going to
I
let
get it.
Rachel and Gina do that.
I get that we are uncomfortable about talking about money, and it's hard to give people numbers. But what I guess I'm trying to explore is, am I going to be burning a bridge in regards to my ability to earn an income for my family? And I think that's what you answered well, is, no, guys, there's ways to create this in a way that can be supportive for your income goals too. Because I know that income and job security have become primary difficulties for some physicians working in the States at the moment. And so we're just exploring the horizon of what it could look like. So we don't need concrete answers or promises, but it's nice to hear a perspective. Yeah.
One other thing that I'll just say, just to add a little bit more color to that, before I started telemedicine, I was always worried about paying for my kids' college tuition. I hadn't saved enough in the 529 plans. My kid is a sophomore in college. I haven't dipped into her 529 plan yet. I've been able to pay for it on an ongoing basis based on my income from telemedicine. So I think things have remarkably improved for my financial health perspective.
Nice. Okay. That's a great answer. That just helps people just understand, is this okay? Is this an idea I can even entertain? Rachel, thank you so much for your introduction earlier. I am curious. So you came in to Chatting Champions, you started to make some changes in your brick and mortar day about your clinic day, and that you said allowed me to start thinking more broadly about what I like and don't like about this and what I want to create. So cool.
Yeah, exactly. And that was exactly what happened.
So tell us what it was about the clinical day that made you think I need something different.
Yeah, I absolutely love family medicine. I knew going into it, I didn't really even consider any other specialty. I saw the statistics. That's really the number one determinant of people's health is really their distance to a family physician. And really strongly believed in preventative medicine and just loved it. So I loved my time with the patients, love that long longitudinal care aspect of it. It's no secret to most, I'm sure, of your listeners, just the problems we have in our American healthcare system, I think, of what's being valued and what's not being valued, especially in primary care, I think. So, yeah, especially I started with when I was starting residency and getting into my first practice, we were really just transitioning from charts to the EMR. So, watching that evolution over 20 years, just more non-physician work being put on the physician and just the constant trying to keep my head above water with the in-basket and the messages and the lab results and getting the notes done. So I tried switching to a different, smaller, it was more of a medium-sized corporate medicine practice from like a university setting. And it was the same. I had hoped it would be different, but it was really the same. So at that point, I really started trying to think about other options. I thought about starting my own DPC. I read a lot about DPC, which I think is a wonderful model. Had I started out from the beginning, I probably would have done that, I think, at this, knowing what I know now. And I just got into, I'd always been involved in a lot of personal development stuff over the years, but I just really wanted to explore ways. I didn't want to leave medicine, but I knew something had to change. I just felt like, I hadn't had a vacation in 20 years where I wasn't managing my own in-basket every day on my own vacations, except for at the very end, I think I had 1 or 2 weeks where we started covering each other's in-basket, but it was just a lot of sacrifice for your health and your life. And my kids were getting older, and I just felt like, gosh, I have a few years before they're off to college, and I just wanted to make a change. And so I had heard about the course, and I just thought, you know what, I'm just going to take the leap of faith. And at first I was going to just do it as a side gig just to try to cut back a little bit on my practice, but really pretty quickly it was really clear to me that I really could replace my income fairly easily actually with telemedicine. And I had to negotiate to initially do outside work and then started getting some pushback about cutting back on my FTE. And I just had a kind of an epiphany moment where I was like, you know what, I'm going to just go all in on myself and really double down on this entrepreneurship world and just trust that it's going to work. And I knew I could, if it didn't, I could always get hired somewhere else, right? So that's one of the beauty of having our education as a cornerstone. So yeah, I really, it was a course that it was available, and I just decided to I had to give a 6-month notice. And so it really gave me just a runway to make sure I had all my ducks in a row before I was done and up and running, and started to do it on the weekends and evenings. And then I was able to see that this really could work and decided to just try to do it full time.
Yeah.
Yeah.
So in the telemedicine practice you have now,
Yeah.
is there continuity with your patients and or what sort of model is it?
Yeah, I have a variety. So we teach people how to do a sustainable practice. So we really don't have just one job. We have a variety of jobs, and because this is a very different world. Startup companies come and then they go really easily, right? The rate of failure of startup companies is pretty high. And so we make sure we have a variety of jobs always on your portfolio. So I've done a variety. I did some virtual primary care for a while for a company. That was interesting. I've done I got obesity medicine board certified also last year, so I do a lot of weight loss in that field. And so one of the companies has your own portfolio of patients, so they were like your patients only. So you had a lot of continuity with that. I have another company that it's really just whoever they log in and get, and so I think they're both valuable models. I really think it's so rewarding. I think I worried about feeling like this wasn't really medicine or this was somehow selling out but I think with COVID, I really fell in love. I was one of my few of my partners that I'm like, this is fantastic. I couldn't believe what we could do over telemedicine when we really had to and you're forced to. You can manage a lot of really, even fairly probably complex things over like primary care type things. Obviously, it's not appropriate for everything and you definitely need in-person exams and studies at times, but I was amazed at what we could do. And I so have continued to, I think now that I'm fully in it, really impressed that I feel like I'm still getting really good care and sometimes even, I think even probably better care at times for certain things. So for example, the GLPs were just taking off when I was still in brick and mortar and doing all the prior auths and I might be have an opening in 3 months to see somebody back to give them the next dose, whatever. Where now with the number of patients I can see a day, and impact is a lot higher, and patients can within seconds, minutes, have answers to their side effects or a dose adjustment if they need it. And just I think the impact is, I know I'm saving more lives or affecting the longevity and quality of life for a lot more patients than I could if I had stayed in my brick and mortar practice. So it's different. It's a different way of reaching people, but the patients love the convenience and they didn't have to take a half a day off of work to come and see me. And they just go sit in their car for 15 minutes while they're at work. And so I do a variety, sorry, back to your question. So I do a lot of virtual urgent care. I do still a lot of sync or video visits, and then a lot of what we call asynchronous, where it's actually not always with video. Sometimes it is, but it's more like text-based or questionnaire-based, a lot of back and forth communication. So I do a lot of that type of medicine. I also do the HIV prep and also NP collaborations, and then also some other leadership roles, medical directorship roles. So the longer I've been in full time for about 3 years. So your portfolio of jobs and kind of changes and evolves over time. And so you end up you find out what you like, what you don't like. You can try something new. You're like, yeah, that's not for me. And so you end up just being able to create the day you want. And some jobs require set scheduled hours, some don't. You can just go on and off whenever you want. And so what I really personally loved is, and I think the most helpful thing that has been for me is really just the autonomy over my time and my schedule. And during the school hours or school times, try to contain it during my school hours into 3. And then the summer or during vacations, I've done a lot of travel in the last 3 years, and I can take 3-week vacations without asking permission. And I'll work in the morning hours for a few hours and then go play all day long and then a little bit in the afternoon. So it's so flexible and I can really prioritize. I can, on a whim, just decide to go to my parents' doctor's appointment with them or to go see a friend. And it's just that kind of flexibility and autonomy that you just can't explain how helpful that is. And then just really being able to prioritize my own self-care.
Tell us about the inbox. So if you order labs, is that
Yeah.
your inbox? And do you have someone covering that then if you're away?
So a lot of what I do doesn't have lab ordering. Some of it does though. So yeah, if it's a platform that you're on regularly, you'll do your own labs, but there's always coverage. If you're away, somebody else can cover your lab results. But it's nowhere near the amount of in-basket that I had as a primary care physician. It's so much less. I can't even, yeah, it's remarkable. Yeah. Because we don't do a lot of typically lab ordering. There's a few things like the HIV prep, every 3 months or STI testing, that kind of thing. But we don't do a lot of see a patient, order CBC, see them back there. Again, in that virtual primary care, I did some of that. But it's just a lot less of your in-basket.
Got it. Okay. So there's a bit less of that anyway. And it's still your responsibility, but the owner's time required is less.
Correct. Yeah. And there's a lot of shared in-basket coverage. Yeah.
And
I
within
also think it's more efficient. It's a more
Yes.
efficient process. Not insulting the brick and mortar EHRs, but they can be a pain. I think most of the digital health EHRs are a little bit more streamlined. So the getting through the lab work,
True.
Rachel, would you agree? A lot
Yeah,
easier.
absolutely.
Interesting. Okay, so
Yeah.
they're using a different EHR model as well. It's fascinating. Okay, things that we could probably learn for our brick and mortar practices by the sounds of it too.
100.
Or maybe having one virtual doctor who does all the in baskets for everybody. I don't know. Who knows? There could be so many more models here.
Yes.
Thanks, Rachel. But Gina, hello.
Hi there.
All right, so you were looking for some growth, and tell us a bit more about what does growth mean? Do you mean that you were bored and stagnant in your brick and mortar and you wanted to learn new skills, or what did you mean by growth? What are you saying is the advantage here of this telemedicine?
One thing I've noticed since I finished my residency, like every 3 years, something different. I'm not sure. It's not by choice, it just happens. Something is changing, but most likely unconsciously, I'm also driving it. Like when I started my primary care, in 3 years, I started doing utilization management. So I became a medical director for utilization management. And then maybe 3, 4 years after that, I became a pod lead or assistant medical director for a region. I think now looking back, I think I was craving for that. I know each doctor is different because I when I went into telemedicine, like when you find something nice and you want to share it with others, right? So I've been actually sharing it with my colleagues in my brick and mortar. Hey, because they're asking, where are you going to? Are you going to this company? So that's the thing. Always our idea is if you're leaving, you're going somewhere else, like a competitor. Say, hey, are you going here? Or I said, I'm actually not going anywhere. So it shocked them. Are you retiring? So of course, I start to share it with them. But some of them, it actually surprised me that some of them, it's like one thing that really stuck with me. One of them told me, "You're brave." At first, I didn't get what they said, but he said, I have 7 years to retirement. Obviously, I'm not happy here, but I'm just winging it. I'm like, so that's why they said, you're brave. So I think what they meant to is at my age, because I'm almost 60, it's like you're trying something new. But I feel like, I think it's probably internal, like I'm craving for something, which is I think my definition of growth. Like I cannot be just in one doing the same thing over and over every day. Like I said, primary care has their own challenges every day, but it's not the kind of challenge that makes me grow. I feel like in telemedicine, of course, I'm just realizing all of these now that I'm in telemedicine. Like every part of your brain is getting challenged all the time, learning a new EMR, learning a new platform, sync versus async, and then like what Rachel said. So for me, this is our mantra or what they always advise us, always keep at least 7 jobs for telemedicine, 7 or more. So that's what I have right now. And one of them is actually primary care. I still do primary care. So I still do the lab ordering. I still have the in baskets. But what Suneer mentioned, it's very different. When I was doing GLP and when they were doing the prior auth, you just, okay, can you sign this? Okay, sign, done. I'm like, why can't they do this in brick and mortar? In brick and mortar, you have to do your own prior auth, you have to appeal, call the insurance. Why can't they do this there? So, like you said, I think a lot of there's different models that can be learned from telemedicine that they can adapt in primary care.
So
Yeah,
who's doing the auths for you within the telemedicine company?
so
How is
yeah,
that set?
so each company has their own support staff. So we
Mm-hmm.
also have our MAs, our RNs. So they are working in the background for you. So once you write that prescription, they do everything in the background and you just get an email. Can you please sign? It's like, oh, okay. It's a DocuSign. You just click sign and then you're done. You don't need to worry about anything.
So does
One
that
of the companies we work for actually developed AI to submit prior auths, to
That's
fill out the forms and submit it. It's
love it.
insane.
Does that mean that your notes have to reflect your reasoning for this medication so that the AI or the RN can actually work on your behalf? Okay, and how are you recording your notes? Are you doing that by AI scribe? Are you doing your typing while you're talking to the patient? What does that look like?
Yeah. Each
All,
company has their own style.
Okay.
Each
all
company
of
has
the
their
above.
own template. Yes, yes. So especially the weight loss, if you're doing purely GLP, like their template is already geared towards that whatever is needed in the prior auth will be addressed in the template. So, which is, I think, very intuitive, right? And not like in brick and mortar, you'll get a task. Did the patient try this and this? And then it's a back and forth messaging, right? So, yeah, that's one thing. Each company has their own platform, their own, each company has their own EMR, which is structured in the way to serve the purpose of their product, or if it's primary care, if it's urgent care, if it's ED or GLP. Yeah, so that's why I think it makes it very easy to process things in the background.
Okay, so that prior authorization form that you look at once the patient's left and you realize you didn't ask these 15 questions, so now you have to follow up with the patient. That has been thought of, brought
No.
forward, and now it's there in the room with you, which sounds very much setting yourself up for success.
Yes. And you're not even the one filling up the form. Yeah, so the nurses do the form based on your notes, and you just get a form to sign. That's all you do. You're not even the one filling up. Yeah. Yeah.
You didn't ask all the questions. Will the nurse then ring the patient to ask those questions that you missed?
The
They
questions asked.
Yeah, the questions are
they're
typically
asked.
it's so well thought through on the intake. Patients are you do have back and forth messaging, so you can reach out to the patient, you can call them, you can message
Mhm.
them. Yeah, there's definitely ways to reach out if you do need to clarify, and there is sometimes clarification because patients don't always add all their medications. So you
Mhm.
need to clarify something, so there is definitely
There is.
and you want to make sure there's the ability to communicate with the patient. But for the most part, most of them have been well thought through because it's not the
Exactly.
first time they've seen it.
Yeah.
Mhm.
And I think most of the time before the patients even get to you, they already fill up an intake form which
Mhm.
asks all of these questions already. So it's not like you're the one asking for
Yeah.
it during the visit. There's one company that I do weight loss, and I'm like, oh my gosh, 10 minutes for weight loss? Are you crazy? But then I realized by the time the patient gets to me, everything's there. So I'll just scan over it. You won't even have to ask, do you have family history of medullary thyroid CA or history of this? Everything is there, right?
Mm.
So I just
And
pop
it's
it.
not in a piece of paper that's been scribbled on in the waiting room.
Yeah.
Electronically in your electronic record for you because there
Yes,
isn't any, I bring my piece of paper to the doctor.
that's right. That's
I
right.
can
So you
see all the
just
family
clarify.
doctors getting mad out there listening to
Yes, I know.
going, why can't we have that?
Still get some, sometimes you'll have some of that where you still need to, but for the most part, it's pretty streamlined.
Okay.
Yeah.
Okay. Now, Rachel, you mentioned texting back and forward. Are you getting paid for those texts? Like, how does this structure of income happen when you're doing this back and forward text advice to your patients? What does
Yeah.
that
So, yeah, you're paid for patient care. So you're not paid for prescriptions. That's actually not compliant. And so,
mean? No, obviously.
yeah. Yeah. So, yeah, different platforms are different. So sometimes some of the messaging isn't not every single message, but you're compensated for the decision making that when you get to that point where you're either closing the consult or deciding to prescribe or deciding to refer them back in person or whatever. So yes, it's there's usually just when we say messaging, you're usually doing either synchronous, which is video or audio visits, or more of the asynchronous or text-based kind of messaging. And I think just to talk again a little bit back, circling this back to error, is it's I think really critical to if somebody decides to go into telemedicine because I think it sounds like, oh, I just need to go get some licenses and start doing it. Like, it's so critical to have formal training because you really can get yourself into trouble. And especially trying to manage if you're going to get highly licensed, like just managing that licensure is a lot to get them, but also to manage the ref and making sure you're up to date on all of your CMEs. Because if you get a board action in one state because you didn't keep up to date, it just snowballs to other state licensure. And then really just to make sure you know what to look for, how to vet companies that are safe to work for, that they're doing things compliantly and correctly. It's a very different world. It's not like your typical brick and mortar It's run by people who really know always what they're doing. Most, I would say, telemedicine company does, but you have to be careful to be able to spot problems. And so if you don't have this community to vet things with or bounce things off with each other, and I think that's one of the best things about this community is it's really very collaborative. It's very growth mindset and abundant mindset. People aren't vying for the same jobs. It's like, yeah, people share opportunities with each other. They are just really helpful when people reach out, and we even create our own little communities with, if you're all working on one platform, we will work together to make snippets that we can use or that kind of stuff. So it's very collaborative, and really, I think it's telemedicine can be one of the downsides is it can be isolating. You're in your house by yourself most days. And so having a community like AIR really is an antidote to that. And we all are encouraging ourselves to get up and get on our desk treadmills and go work out. We've got our Slack channels, and there's the workout Slack channel. And then we have, at the end of every cohort, we have retreats. And so we really do get together in person and get to really know people. And some of the people I would consider my best friends at the moment. They're just really an amazing group of people and entrepreneurially minded and like-minded about growth. And as Suneer said, there's people who are doing this just to support their real estate passions or want to just do it because they're just really burnt out. And as a coach, I think it's really now watched the last 2 years, I've watched 4 more cohorts come through, and it's just so fun now to see where people are at the beginning. And as you said, it does take some bravery. It's a big leap for people. It's a big investment, and you have a little bit of reassurance that there's all these docs ahead of you, then 5 cohorts now that have done well and succeeded if people are doing kind of the steps that we recommend. But it's still a lot of transition. And so that's what we do, is really help people, not just with ABC of how to start your own company and how to do all the steps and the lectures and how to do telemedicine safely and compliantly and with good medical care. And I think that's, just to plug that too, I think we are also very big on doing good clinical evidence-based medicine, making sure if you are doing good care, most of the time you're going to be just fine again. But having this community to fall back on and just continue your education is just critical. So I don't recommend people just going out and doing this on their own. I think you don't need to reinvent the wheel. It's worth investing in your education about this so that you actually will do much better financially. If it's for financial reasons not to take a course, it's actually you're going to do much better financially if you take a course, invest in that, and learn how to do this really well and efficiently. And then there's just all the other perks and benefits of having the community.
Yeah, fair enough. Sounds like a good plan. Tell me about licensure in 51 states and keeping up with the CME. What does it cost to get licensure in 51 states? And do you have CME parties so that you will keep up your compliance for that? Do you remember how to, oh yeah, we're going to do all of our CME right now. Everybody get together.
Actually,
That's a good idea.
I never even thought about that. Rachel, let's note that down. I actually think that's a fantastic idea. Okay, so what's your question about licensure? Why 51? How much it costs?
No, why 51 cost, annoyance, streamlining it. Have you guys come up with a formula? Do you know what it looks like?
Yes. So there's a way to streamline it. You hire someone to do it for you.
Beautiful. That sounds great. Yeah, pay someone to do it. I love that. That's a great use of your time.
You can do it yourself, but I think you have to be, and there's people in our community who've done it themselves. And I consider them brave. I consider them a special type of person. I have way too much ADD to do this on my own. And I'll tell you, most of the people that come through our community have way too much ADD to do this on their own. So that's number one, right? I think it's important. It is actually really quite complex. It's more than just filling out paperwork. You do have to understand how the licensure process works and how each state interacts with each other state. And that really helps prevent administrative paperwork. It helps prevent exorbitant costs, unnecessary exorbitant costs. I'd say that with using a licensing professional, you're looking at about $60,000 for all states, going from 1 to 51. And then your carrying cost after that, year by year, is probably in the $10,000 to $15,000 a year range. But really, in telemedicine, all you need is your licenses and your computer. That's your startup cost for your business. Whereas if you're in a brick and mortar setting, there's a lot more that you're going to need to invest in. So we feel that even though it sounds like a lot, it's really not that huge of an investment from a business startup perspective.
Yeah, if you're going to start up your own business.
Yeah.
They have 0% interest credit cards. That's what I do for a year. So I put them on 0% interest credit cards for a year to take the course and to do all the licenses. And I pay, and I just had faith that I would pay it off in a year, and I did, just with as the income started to come in. So I didn't have that sitting around.
You think that, Rachel, you think paying off $60,000 in a year in telemedicine is that hard to do?
Not at all. No.
Not at all.
And you make it up in less than a year of doing telemedicine. Yeah. My husband asked me, did you make up for everything that you spent?
For sure.
Oh, yeah. And
Yeah.
more. Yeah.
Yeah. Now, the Y51, honestly, if you have one license, you're seeing patients in your clinic, right? And you're limited to the patients in your clinic. If you're seeing 51, if you have 51 licenses, you can see every patient in America. There's 300 million patients in America, right? That gives you flexibility, opportunity, leverage. It just opens a lot of doors for you in terms of the types of jobs you're going to get, what time you want to work, how you want to work. It gives you the maximum amount of opportunity. You can do this with less, but if you're already bought in, I'd say you need at least 20 to have a sustainable career. If you're already doing 20, getting 51 gives you the maximum opportunity, maximum flexibility. That's what I would suggest. Additionally, there's specific opportunities that would only come to you as a 51er.
So if you wanted to niche down like obesity medicine or PrEP or menopause or something, having 51 gives you more patients because you're now over all of the.
Yep.
There's like a waiting room of patients. And so if you get one state, you might get one an hour, but if you got 51, there's just a constant stream of patients.
And
there's a lot of aging.
So you could start with one. You just have the breadth of patients and the number of patients just sitting there waiting for you to talk to them.
Also the time zone flexibility. All right. So like in the East Coast, if you're working in a clinic, you're really mostly seeing patients between 9 and 5. There are clinics that have like after hours, but I could wake up at 4 a.m. and see patients from 4 to 7, take my kids to school. Like I could do that if I wanted to. I could go to the gym in the middle of the day and not worry about coming back and not having patients to be seen.
Yeah, but do pickleball from 9 to 11.
Yeah.
Yep.
Join team sport, which is who gets to join team sport when they're a physician, right?
Exactly. Who gets to travel for 3 weeks and do that? Yeah, for sure. And I wanted to also just point out too, and I'm sure maybe Suneer was going to get to this, but majority of, I think, people that have joined are EM, IM, or FM, some pediatricians, but we have quite a few of specialists as well that have gone through AIR and have found a way to find their niche, and a lot of OB-GYN. So there's a lot of women's health opportunity. We've had several cardiologists, cardiothoracic surgeons, rheumatologists, hem-onc. I'm trying to think, Suneer, who else has gone through, and it's a different path. They're not necessarily doing all like urgent care, but there's so many unique areas, and we're all physicians. We all are basic training. You can learn a lot of kind of niche areas as well, but also they tend to probably more quickly get into some leadership roles where they're helping to create protocols or medical directorships, that kind of thing. So it doesn't have to all just be IM, FM, ERs. Yeah, there's a lot of opportunity for multiple specialties.
Yeah. All right.
And people have started their own companies as well. So even doing like remote second consultation type of stuff as a specialist. So there's just, there's so many things that are developing, especially with AI and all kinds of remote monitoring that can be done.
Love that. Very good. Anything we haven't spoken about that we should be talking about before we end?
I really like what Gina said about how brave she was. I do think it takes some courage to make a transition. I think that it's important. It's important for people to understand when you're brave, that's where the growth actually does happen, is pushing that boundary. And I think the three of us really have had a lot of fun growing into telemedicine and not listening to the voices telling us not to, saying it's going to be boring, saying it's not going to be fulfilling. And because we took the leap, we were able to find a different version of that story in our lives. And I don't think it's a field for everybody, but I also don't think you should let fear hold you back.
Yeah. And I would piggyback on that a little bit too. I think just as a general, to any people are listening, like, you aren't as stuck as you feel, you're not stuck. And there's endless possibilities. You really can redesign your life no matter what stage of your career. If you're starting out, if you're been doing this for 20, 30 years, even if it's just a matter of getting more efficient and getting some bandwidth in your clinical day, or renegotiating your contracts are renegotiated. You can redesign even your outpatient work as an independent contractor for the company you're working for. You can do, there's so much other area, expert witness work. You can do telemedicine. You can start your own practices. There's just, don't be afraid to look outside. You're not stuck. And to really, like, life is short, right? We all know that, but just really doing things that are going to take care of you. I think physicians are not told to do that very often. And so it's okay to recreate a life that gives you the things that you also want to do.
Sure. Yeah. In my experience, it was really difficult for me to transition to give up my W-2 job to being a 1099 independent contractor. And Rachel was my coach when I started in my cohort. So she was my coach and she knew everything that I was going through. And one thing that really stuck is I was telling her, how about my health insurance? I'm the only breadwinner. I have to get the health insurance and all of these things. I keep coming up with reasons. And then one thing that really stuck with me that she mentioned, those are your golden handcuffs. I said, oh, yeah. So, like you said, it's so easy to come up with excuses, but if it's something that you really want to do, you can always figure things out. So now looking back, when I look back now to the time when I was struggling with all of those thoughts, it's fulfilling to just think that, hey, I got through all of that, right? So yeah, now I got my health insurance. I figured that out. And I guess, again, it's the support of the community that will help you really be able to jump through all of those fears. So probably with me doing it on my own, oh my gosh, I enrolled into so many things that I never got anything done. But with here, I'm really glad it's the community that's supporting you because you will always find something that will hinder you. So, yeah.
Yeah. Suneer, where do we find out more if we're interested in the AIR?
Oh, yeah. So we have a website. It's pretty easy. It's www.airphysicianacademy.com. If you go to the top right, there's a request info or join an info session button. And you click on that and submit your interest, and our team will reach out to you.
Perfect. And I have one more question for you, just because you mentioned the ADD. I have a lot of ADD physicians who come into my world because, of course, struggling to get the boring stuff done is very boring and it's hard to do. And so they have a lot of backlog and a lot of struggle with the clinical day. How did you find telemedicine from the point of view of you're in your house? Now you have to work here. Now you have to see patients in your house and you have to get your work done. Was that a challenge or did you find it entertaining? What were the sorts of things you had to overcome when you think about your brain and telemedicine?
Yeah, it's a really good question. I do think that telemedicine is very conducive to the ADD brain.
Okay.
Right? I'll tell you, I have two screens, right? So I go between browsers. So there's a squirrel over here, there's a squirrel over here. It is definitely conducive to it. That being said, I have my Pomodoro timer, a time block. I've really gone through some self-discovery on what works for me and how to get me seated in my computer or in front of my computer. I think there's a lot of personal growth that happened to allow me to do this and skills that I needed to attain. I think they're very attainable skills. You just have to be committed to it.
Yes, but the challenges are not immediately overcome. Is that you're not just suddenly
No,
expected to work in your
no,
home.
no. But I think it's also important to consider the alternative. The alternative was I was going in, doing night shifts, coming back, not sleeping well, having dinner with my kids and yelling at them because I was so cranky. I was very motivated to not be like that.
Yeah.
And if that means I had to conquer some of my ADD skills with like devices like this, which I know sounds ridiculous, it's totally worth it.
Yeah. Yeah. And I guess the different styles of telemedicine work that you do will impact you differently. So you'll find some better than others, I'm assuming.
100%.
Yeah. Okay, good. Thank you so much for that little insight, because I think that definitely a decent amount of listeners will have identified with either the burnout in attention and executive functioning stuff or true ADD diagnosis. And if they're looking at this as an idea, then they're going to have some hesitation with, will I be able to make myself work from home? So,
yeah.
Thank you all so much for coming. It's been really wonderful talking to you all. And I think we've explored this from a lot of angles. Hopefully we've tickled some brains out there.
Thanks for having us, sir.
Thank you
so much.
All right. Thanks, everyone. Have a great
Bye.
week. Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast, and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have Charting Champions for physicians and Smarter Charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.